Home Minister Amit Shah is chairing a video conference with the Delhi Chief Minister Arvind Kejriwal, Deputy Chief Minister Manish Sisodia and the Delhi Lieutenant Governor Anil, Baijal, among other officials. The meeting comes a day after the controversial order for mandatory institutional quarantine was revoked by the Delhi Lieutenant Governor. My colleague Sukirti, who's tracking the details of this story, is joining us on the broadcast. Sukirti, important meeting there underway. This is the second meeting that we're seeing in a span of a week. What more can you tell us?
Well, yes, last Sunday we had seen the first in a series of meetings that's been going on between these two key ministers, Mr. Kejriwal as well as Mr. Amit Shah. Then there was also an all-party meet in which these two people met, and now on Thursday also they met, and now they're meeting again. Now, what is the kind of assessment that they are looking at this point of time? First, of course, on the agenda is going to be the hospital beds. Is Delhi prepared in terms of the kind of requirement that has been projected on the basis of the doubling rate of cases in Delhi? So 1 lakh cases expected by the end of this month, a need for 15,000 beds. By 15th of July, almost 33,000 beds will be needed. So those, well, are they prepared or not? All the hotels, banquet halls, railway coaches where all these beds were supposed to be set up, are they set up there or not? Then, of course, there were other two orders that had recently come in. What has happened in terms of their implementation? That is also going to be something that all of these key officials and ministers will be looking at. One, of course, is the price cap on the tests for COVID, which have been capped at 2,400 rupees, 2,400 rupees. So that's one order that had come in. Apart from that, now even for isolation beds and ICU beds, prices had been capped. So something that was costing you around 25,000 as an isolation bed now would cost you about 10,000 rupees. So they were also supposed to be implemented. So those are some of the key areas that they will be looking at and discussing how the strategy is going to go further in the upcoming days as the number of cases go on increasing.
Right. Also, Sukirti, the other crucial development we're tracking from the national capital is the new rules for home quarantine. That, of course, that has now come in place after the controversy over the compulsory institutional quarantine, the order that was, of course, revoked. What's changed? What are the new updated rules as far as home isolation is concerned?
Well, most of the protocols continue to remain the same, but one, of course, big change is going to be that now you will have to personally go to the COVID care center, and then that is going to be the place where you will be questioned. Earlier, what was happening was either the health workers would come to your house, these ASHA workers would come to your house, they would ask you questions about are there any senior citizens in the house, what are the comorbidities that you may be suffering from, hypertension, diabetes, what are really the dangers involved, and then, of course, a physical assessment of the house in terms of whether you have 2 rooms at least, and do you have separate toilets to create the kind of right social distancing that would be needed in such circumstances. But now you will have to face all of these questions after going to the COVID care center, and then they will take a call on whether you can actually be under home isolation or not, or whether you will have to go under institutional quarantine.